I'm a uro-oncologist. That's a urologist who specialises in cancer treatment, particularly bladder cancer. Now, a urologist is a doctor who specialises in surgery as well as medical treatment of urological conditions. So that includes conditions of the kidneys, the ureters, the bladder, prostate, if you have one, and the urethra. Common way that patients present with bladder cancer is with hematuria, which means blood in the urine. Often that blood is visible as it's red urine, or sometimes it might just be microscopic and the GP can pick it up in a urine test. Very occasionally, patients can present with other symptoms such as pain, or sometimes bladder cancer can spread beyond the bladder to liver, lungs, bones, and you can get symptoms from those organs as well. The important symptoms and the history of the symptoms that I would be looking for is first of all the bleeding history, the blood in the urine, which we call hematuria. How long have you had it? Because that'll give me an indication of how long you might have had the bladder cancer for. How bad is the bleeding? That can sometimes give us an indication of how big a tumour might be. The colour of the blood is also important. For example, if it's bright blood, it means that the tumour might be actually in the bladder, and if it's dark brown or old looking blood, it might be further up in the ureters or in the kidney. The second question I'd like to know is, are there any predisposing causes that made the patient develop bladder cancer? And smoking is by far the strongest cause. But there are also other causes. For example, certain occupations have a higher risk of developing bladder cancer. And these occupations include people who are in the rubber industry, textiles industry, paints and dyes, hairdressers, and also the petroleum industry have a higher risk. The next set of questions that I'd be interested in is knowing whether this bladder cancer has spread any further. So I'd be looking for symptoms of the bladder cancer outside bladder. For example, if it's causing blockage of one of the ureters, which is the tube leading down from the kidney, you might end up with pain in the loin. If it has gone to the lungs, you can sometimes end up with shortness of breath or cough or coughing up blood. If it's gone to the liver, you can end up with jaundice. When we examine someone with potentially having bladder cancer, the first thing we examine, of course, is the bladder. Usually we can't feel the tumour within the bladder, but if a bladder tumour is very large, sometimes we can. The rest of the examination includes examining the kidneys to make sure that they're not tender or enlarged, and also in examining the liver, because sometimes bladder cancer can go to the liver and we can feel it if it's enlarged. A chest examination is also very important, as well as examining all the lymph nodes in the body, because that can sometimes be involved with bladder cancer. So laboratory investigations are very important in working up someone with potentially having bladder cancer. So we have a number of blood tests that we need to order. The first is called a full blood count, and that looks at the hemoglobin level to make sure that the patient hasn't lost blood to lower the count. The second is we look at the kidney function, because sometimes bladder cancer can block the kidneys and lead to worsening kidney function, so we can do a blood test for that. The next set of tests are urine tests. The first one we usually do in anyone that has blood in their urine is a urine culture to make sure that it's not an infection that's causing this blood. We also do 3 sets of urine tests called urine cytology. And what urine cytology is, it's looking for cancer cells under the microscope, and a patient has to give a full bladder volume, and the pathologist will spin that urine down so that the cells sit down at the bottom, and then you get it stained, and then you can see cancer cells in that. So the urine cytology is a very important test that we look for. Imaging investigations are also very important in working up someone with potentially having bladder cancer. Usually the first investigation we order imaging-wise is called a CT-IVP. And what that is, it's a CAT scan, and so the patient sits on a table and goes through a donut, and the whole body is acquired in imaging using X-rays, but it's more sophisticated. And during that imaging process, you also get contrast giving through a intravenous drip. And the pictures that we get from that tell us that the kidneys are going to be okay. It also looks at the bladder to see how big the tumour is within the bladder, and it also looks at the rest of the abdomen to see whether the cancer has spread beyond the bladder to lymph nodes or liver or anywhere else in the abdomen.